Very good evening, everyone. This is Amisha Paul. A very good evening once again, everyone. This is Amisha Paul, Nutrition Counselor of FSTN Exploration and Foundation. Today, we all have gathered here for the seminar on personalized breast cancer detection, integrating AI technology with clinical decision making. Today we have our special guest, Dr. Nabanita Ghosh, is an assistant professor of clinical nutrition and dietetics at Satyabama Institute of Science and Technology. She holds a PhD in food processing and nutrition science from Indian Institute of Engineering, Science and Technology, Shibpur, specializing in bioactive component and characterization. With 9 years of teaching and research experience, her expertise spans food chemistry, nutraceuticals, product development, and sustainable food systems. She has published widely, contributed book chapters, received a Best Oral Presentation Award, and is a life member of Indian Dietetic Association. And also everyone, if you have any queries, any doubt, when ma'am completes her session, you can clear all your queries. Over to you, Nabanita ma'am. You can start today's session.
Thank you for the welcome. Am I audible?
Yes, ma'am. You are audible.
Actually, today we have, I think, two keynote speaker. One is me because I'm not AI expert, and another
Yeah,
one
yeah.
is Dr. Devi Podojana. So for me, I will be just informing about what the cancer, what are the possible prevention we can take as a nutritionist. We can advise people because we all know cancer cannot be treated only with nutrition, but along with medication, we should follow a proper nutritional journey to cure it on a speedy level. So now I'm sharing the PPT.
Yeah.
Okay.
Okay, ma'am. Yeah.
Is it visible?
Yes, ma'am. Yeah, it is visible.
Okay. So our today's topic is personalized based cancer detection, where we using integrating AI technology with clinical decision making. So we all know that nowadays in women, basically in women, we that the cancer most probably seen in women is the breast cancer, along with cervical cancer. Though now, but nowadays breast cancer can be seen in men also. So first, what is breast cancer? Cancer is a uncontrollable cell development that eventually end up in having a tumor. Okay, so those are having uncontrollable growth and that needs radiological treatment. We call them cancerous skin, cancer prone tumor. So to detect whether uncontrolled cell growth is a tumor or it's a cancer prone, we must go through radiological survey that is called biopsy. That is all called, that is why each and every surgical operation, the doctor advise a biopsy to detect whether the operative tumor is the only tumor that can be treated with surgery or any medication, or it's a cancerous growth that needs radiological as well as some chemotherapeutical treatment. So this is the chart, global chart, where we can see that women, especially annually, 2.3 million new cases are reported annually globally. So it's a high concern for both for developed and developing country. Underdeveloped country we cannot consider because there are a lot of things they are happening in that country. So they lack in basic facilities. So this is if we have to think if this is a scenario in developed and developing countries. So what could be the scenario for the underdeveloped country? So 2.3 million new cases as per WHO. It's not any data that is research data. It is the research data provided by WHO. It is 2.3 million new cases are annually reported. So that is why it is advised for a routine thorough checkup, maybe monthly, maybe quarterly, or once in a year to go thorough checkup so that we can detect if a woman breast is prone to cancer or not. What is the importance of early detection? Because if it's detected early, so there are chances of survival, because we can have a time to get it treated. Because if it's on a stage one, or if it's just beginning, so the treatment will be the doctors may have a lot time to get it treated, and that as well as the treatment cost will be low, so it can be accessible for the lower income group or middle class people also. So some of the importance of early detection and survival difference, obviously stage 1 detection. If the breast cancer is detected at the stage 1 level, so there are 90% chances of 5 year survival. Or if you detect it on an early stage, sometimes the removal of the entire breast or the part of the breast may lead the patient to survive for a long time. I know personally person who detected breast cancer in early stage, and after the removal of the affected breast, she is still now she is living in a perfect healthy life with proper medication and nutritional care. I am talking about back in 2009, she is detected stage 1 breast cancer, and after a lot of chemotherapy and all stage. So early detection is very much important. And according to American Cancer Society, if localized breast cancer, that means if a part of the breast is affected, not the whole breast, so there are 99% chances of 5 year survival, because that part can be removed, and after thorough chemotherapy and radiological survey, the patient can may have lead a healthy lifestyle. And distance metastasis, so that can in that cases, there are, if it's detected in early stage, 30% chances are there. So we are here gathered to know what AI can be used, or what is the use of AI in early detection of cancer. Because we all know in Indian society, people don't go for a regular full body checkup like a weekend plan. I stayed in Western, so I know there are people they go for a thorough routine checkup once in a week. Here we don't do that. So in Indian society, there is a very lack of chances of early detection. So in that scenario, how AI can be used to detect cancer in early stage so that a patient can live a healthy lifestyle for a long time period. So during the early detection, some point has to be checked, that is used in the current practice is radiologist workload. If it's detected in early stage, so radiologists, those who use the chemotherapy to the patient, they can be really, because we all know radiologists nowadays, radiology or those allied health science MLT, those are the budding subject. Those are not in a ancient subject like maths, physics, history, chemistry. Those are budding subjects. So the professional, those who are doing the radiological job, radiologists are limited. The source is limited. Over the 5 year, maybe the number will be increased, but currently limited numbers of radiologists are available. So if it's detected in the early stage, so the radiologist workload can be minimized, and each and there is a chance that each and every patient can get a radiologist on time. Increasing screening programs worldwide. Worldwide increasing screening program is there through AI or through normal screening process that is done if a patient is susceptible or suspected lumps in their breast. But in India, in our country, the sources are limited. So early detection is very much helpful to have the patient in their proper medication journey. Aging population. Breast cancer, nowadays it is majorly it is seen in early menopause for women, or after in menopause women. So in aging population in India, aged people are there on a huge number, because the mortality rate is up to 90 years. So in any stage, the person or the patient can may have breast cancer symptoms. So to decrease the workload, we should have early detection, because if it's detected in a old age as well as in a stage 3 or stage 4 cancer, so it's very difficult to treat the patient, because in elderly or geriatric people, their body is not able to take the load of a chemotherapy, because chemotherapy needs a lot of injection, a lot of medication. It's a very painful process. So to consider the age of a patient, aging population in India, we should emphasis on early detection. High volume of mammography screening. High volume of mammography screening is not available in India right now. Those who are available very limited. All these super specialty and multi specialty hospital and those cancer special institute, but it's not accessible to each and everyone because of the per capita income of Indian economy. And some countries face radiology shortage. That is the first point I have discussed. That radiology is a budding subject. Maybe after 5 or 10 years, there will be a lot of professional available. Those radiology professionals will be available, but in this stage is very limited, because after the COVID, where people have started thinking about allied health subject courses, nutrition, those medical lab technology, radiology, those subjects emerge as a new emerging subject. So radiology is a budding stage. So there is a shortage of radiology specialists worldwide, not even in India, worldwide. So why AI? What AI we do? That we should think that AI is not replacing radiologists. The radiologist work that is giving chemotherapy, that can be carried out only with a specialist as radiologist. AI is a tool. It's a software. It's a tool that can help the radiologist to detect the patient stage of cancer faster, but it cannot replace the work of a radiologist. The use of AI in early detection of breast cancer aims to is like a second reader, because if when the patient is going to radiological screening, AI with the software and AI, if the radiologist can be benefited, because he or she is not here. They do not need to study the each and every point of the stage of the cancer. Tool is there. If you are putting the result of the radiological screening, the AI tool will give the result whether the patient is having stage 1, stage 2, stage 3 or stage 4. The radiologist is relieved from that study, that whether the patient is having stage 1, stage 2, stage 3 or stage 4 breast cancer. Not even AI is not limited to only to breast cancer. It can be used to detect each and every kind of medical field, but this is in its process. It is in process. It is going on research, because AI is very much new. Improve sensitivity. The instrument that are used to detect the level of the cancer, if we are using AI, it improves its sensitivity. That means precision. Human error is removed by the using AI software to detect the cancer, and that is this reduce the false positive. Sometimes human error will be there, that some negative cases can be detected as a positive, because some symptoms will be same. But if we are using, or the radiologist are using as a software and tool, so there are chances of low chances of, not low, sometimes no chances of false positive result, because software cannot give when you are putting instructions, uh, the software should give the perfect result. That is why it's AI. Okay. Reduce workload. Obviously, if you are using software, you don't need to do everything manually. So there will be reduced workload and improve consistency. As we are using software, whenever we know, whenever we are doing anything manually, and when we are doing it with the software, the consistency will be high, because just one click and one button, one comment, and your results will be ready. So AI is very much needed in detection of not even breast cancer, any kind of disease, so that there will be less chances of false positive treatment, precision and consistency. Okay, so I'm not a AI expert. Rest of the thing, how AI will help to detect the breast cancer in early stage. Okay, whether the patient is having breast cancer or not, that will be given by Dr. Devipada Jana. He is a project scientist, National Quantum Mission, Government of India, IIT Madras, Department of Electrical and Communication Engineering. So, uh, can I leave now?
Yes, ma'am.
Okay, okay. Thank you, thank you.
Yes, ma'am. So everyone, to the now we have our second guest. He's Dr. Devipada Jana. He's a distinguished academic in optical communication, photonics, and advanced signal processing. His research focuses on optical fiber system and AI ML enabled optical network with impactful publication and recognized contribution to next generation communication technologies. We are honored to welcome him as our keynote speaker and look forward to this valuable insight and inspiring address. Over to you, sir. You can start your session. Sir, are you there?
Hello.
Yes, sir. You're audible.
Yes. 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 Mhm. So I'll share the presentation again.
Yes, sir.
Can you see the presentation?
Yes, sir. It's visible.
So Dr. Namanita has explained up to this one, or why AI. So she explained the motivation, and these are the points. So then why AI? She explained this thing, right?
Yes, sir.
Uh, and the best concept types. These are the things this slide she discussed, or this breast cancer types she discussed.
Yes, sir.
Okay, and the other the I mean the way to get the image, the mammography ultrasound. See, can you see the presentation?
No, sir. It's not visible now.
Okay, now
No, sir.
now can you see the presentation?
Yes, sir.
Okay. This one she explained the imaging methods to get the image for the processing to get the AI applications. Okay, so things comes from that I will just so the motivation is the breast cancer is one of the. I'll just go quickly from the beginning, then I will go to the AI part, whatever I explained here. So it's a very common problem here that according to the WHO, we all know it's very worldwide problem, the breast cancer detection, and it's important for the early detection and then, due to the manpower or radiologist or clinical staffs, the working procedure or other things, or in fact the data overload, we need the machine learning or deep learning algorithms for our, I would say, for the better performance or correct detection. That is the final objective here. To utilize the machine learning or deep learning that is there now, much more prevalent in coming times also it will be because of the handling huge data. That is the main thing. I mean, as you all know this. So these are the breast cancer types that the ductal carcinoma and lobular carcinoma. And so the idea is to get the detection whether it's benign, means whether it's good or there is no danger, and or it's malignant. I mean, as the bio related people also know this terms very well. So there are certain methods to get the image. So first thing is that we have to get the image from the detection or from the procedure that first of all we have to get the image, then this image data has to be processed. So in my research area I used to work in the signal processing. The same idea people used to do in the image processing. So, but this is particularly based on the medical image processing, whether people are analyzing the data or by taking the images from that are related to the health domain or medical applications or other, whatever the thing is related. So, the mammography is one of the I mean, one of the thing to get the breast X-ray image from the related to the breast cancer detection, and then ultrasound also. Whether where we send sound waves, these are the procedures that we all know in work everywhere it's there. It's not exactly X-ray. So, and there are also one procedure in MRI that strong magnets or radio waves are sent consecutively to get the image. So, idea is to get the image finally. And challenges is that we have the dense breast. This is one of the things that I saw is highly prevalent in Asian women, and because we need to get the clean image and low contrast license. So these are the if we have the affected area or the abnormal growth abnormal tissues, then if there is a contrast or brightness mismatch, then it's also hard for the getting the image. So we can get the false positive, or then it will be a problem. Then so we have three types of data that we basically process for the to get the detection whether it's malignant or cancerous or not. So the imaging data, the pixel level that we get from the, as I was saying, from the mammogram or ultrasound or MRI, and then we have the clinical metadata, the patient data, as I will have some idea from the, I mean, maybe you have people have better idea about that. The patient information from the health information as we see in hospitals. Then, so the pathology level, so there is zero. This is the thing we do in the machine learning applications that if it is zero, that we put some labels that I will explain after some in the coming slides. Is zero, it's benign, or one is malignant. So when data type is the only having some values or imaging data that we have to process to different I would say different algorithms or different mathematical formulas. So how the deep learning or artificial intelligence or machine learning tools are actually helping here. So the first thing is that what is the artificial intelligence or AI? Is the ability for the of a computer system to learn patterns from data and make decisions from the data. So once it learns the patterns, then it can do by its own. So the idea is to, as I have just explained, the idea is to feed it to lot of data. So that's process the training, and then there will be testing. So there are two parts in all the machine learning algorithms. So what is the deep learning is there are other levels in between the in fact there are multiple layers in the algorithm. So it's the deep learning or deep neural network, that's another thing. So the types of AI relevant to imaging is the machine learning that needs extracted features. The supervised algorithm based uses labeled feature vectors. So I will explain in one picture that will be bit, clear about the thing. So that thing is that we have basically two types of machine learning. That is, I would say, that would be applicable here. That supervised and unsupervised. So unsupervised are the mainly from different clusters. So that will not be too much helpful here. That cannot classify the data whether it's benign or malignant. So we have our my target is to get the idea whether it's cancerous or not. So we have to go for the label data. So what happens is that we have get some. I will explain in one. Okay, so this is one picture that you can see here. The gray level for occurrence matrix texture features. I can explain it very simple way so that it will not be too much complicated. So we get some image. So the idea is to get the uh, features from the image, and whether it's uh, cancerous or not, that is the main thing we have to find. So the original image is divided in, we take the different points from the image. So you can see the blue points are at the periphery and the green at the center. So we took four center and four different data from the periphery also. And then, as I have just mentioned here, so then what we do is that we find different features from the of the data from the image. So these are the I mean, whether if the data correlated. I mean, it's a simple uh, thing like if y is dependent on x. If the data is correlated, then there will be higher correlation. And if there is much more correlation, it will not be cancerous, because the cancerous tissues or the it will be abnormal growth. There will be less pattern that we can detect or we can predict. So we cannot predict that cancerous tissues or cancerous affected areas. So there will be higher entropy. There are different methods to find the entropy, and finding the area of a circular circular, I would say circular object, circular feature, or area, perimeter, everything like that. So uh, there are different features we can found. So from the image of a, so I put yeah, algorithm and the steps just as a out layer, or I can explain step by step so that it will not be complicated to understand. So the mammogram with suspected region will give an image. Then we take the image by cropping, and the abnormal growth of tissue, that is the lesion region. We take that, and from that we complete features, and we get certain things like correlation I was just explaining. Then say area, perimeter, like this, and say correlation and entropy. These are the things we found, and then we get a feature factor of all the terms. So it goes to the machine learning algorithm. So where the machine learning comes, for that there is a machine learning. This one is the basic machine learning algorithm is the classifier. It's the support vector machine. So what it does is that basically it takes the data and it divides into two different levels. So zero means one level, one means another level. So it basically put a threshold, or I would say basically put a boundary in between that. We call it as a decision boundary. The statistics or data processing purpose. In fact, is called the decision boundary region. So as wide is the boundary, I mean, two different data are, then it will be would give a better performance. So then we get the idea whether it's benign or malignant. So this is the thing that it takes a decision boundary to get best separates benign or malignant cases. And now we go for the deep learning algorithm because it's method. So the point here is that we have to give the feature vectors like the center periphery as a or say different features to designate or to get a proper idea about the region of the image. So then this is one manual work. Then the algorithm or the AI it will form one boundary to get the detection. But the deep learning or the deep learning algorithm it gets the it's a method that where the computer automatically learns from the important patterns. I mean directly from the images without manually giving the feature. So previously you cannot give the whole image. We have to give some features so that it works. But here it learns from the image itself by a different method, and then it works by itself. So it's much more efficient. So this is one thing. I mean, like if you just avoid the equations also, the idea is basically that this is the machine learning algorithm, and this is what the input xn. The output is final output here at the end. So what happens is basically the input signal or input image, we can say image here or data, it goes through the one algorithm or one filter or whatever. It goes through one algorithm and it gets one output. And so our target is to get the DN here or the final thing, or I would say we say it's a desired signal. So this is one thing is related to my research area. One is the adaptive filter. So it's just a algorithm. It works adaptive. It updates adapt or it's adapted according to the input data and the weights. So this is the main thing behind the artificial neural network, convolutional neural network, or deep learning, everything. So the main goal is to minimize the error between the desired and the output, the D and Y. So it gets on error and it updates itself according to the error. So this is the over iteration. As long as the error becomes zero, it goes on like that. So as I was just saying that there is a deep learning different layers of there, the deep learning algorithms or deep learning method. So normally for imaging we usually use the convolutional neural network. So here the as I have mentioned three inputs and two outputs. So there are hidden layers in between that. And I'll go to the final thing that we directly cannot handle the raw images. So but this is the idea behind the deep learning algorithm that there are different it takes different inputs and according to the weights it updates itself with the different activation functions are there. So what is happening with the image is that it takes the input data, images or information, and then with the different mathematical function with weights, it calculates the error, and as I was just explaining, it updates its weights to get the final output. So in this best imaging, I mean, it gets the image of the affected area with the abnormal growth, as I just mentioned. So the convolution is the it detects suspicious texture or irregular edges. So this first thing is that it takes the so what is the difference in the uh, previous method and here it takes directly the data. I mean the image. So it has a suppose it has a 1024 I mean 1024 by 1024 2D data. So it takes the data and by the convolution method, uh, this simplified method, I can say it just detects the exact matching data or the suspicious text set or whatever need to be processed. So from and that this method is the weights are also updated according to that. So then the pooling is another method. So the convolution pooling, this thing goes on. So it compresses the data, it gets the some strongest tumor signal, and then finally by updating the defined words, as I have just explained, it gives the final output, the final detection. So the convolution layer is a small filter slide over the image to detect the pattern, and finally I can say that it combines the learned features to output final prediction whether it's benign or malignant. So it gives it gets the features by this method, and this deep learning is very effective here, and so it handles the very high dimensional data and detects the pattern and works consistently with democratic. So one, I mean, as a simplification or simplified example, I can say is that this machine learning or AI application. Here I can Okay. Here I can just give an example. So this we have some idea about what are the image and what are these features. Now, suppose a health professional is there in a hospital or anywhere. So then, suppose we show him or her about this image, then I can say that okay, this is benign and this is malignant, or this is cancerous, this is okay, I mean not cancerous. Then he or she can predict some idea about that. So suppose I'm giving him or her 1,000 or say 10,000 examples. So after certain time, that person will be exhausted. So that I mean, it's not possible for a manual handling. But the idea is to again the same thing, the machine learning or the AI or deep learning or whatever. But the main thing is the AI. Then the machine learning, deep learning, and other generative AI, other things are there that it can handle high dimensional data and works consistently with no fatigue. That is the simplified explanation I can say, and it supports clinical decision making. So there are other self-supervised algorithms, other things are there, but these are the main things that I found effective here. And deep learning is with the end-to-end learning, we is very effective for processing the image directly, and also you can extract the features much more higher features, and it's robust to noise. I mean, the efficiency is very high, so we usually put different data and say 70% or 80% data for the training, as I was just explaining that 10,000 or say 50,000 data on image has to be shown to a person, then he or she can idea, okay, this is good and this is bad. Then after that, so this is training. Then after certain time, the person can get some idea that by visually, I mean, by seeing the data that whether it is good or bad. So then the process will be faster. So the AI does that thing. And also, one important point is that AI alone is also cannot be trusted sometimes. So it's the second process of the or second step will be better after the human thing. So the best performance will be human plus AI. That is the main thing. And also there are false positive detection are there, and so this has to be also take, taken care of. So AI is the decision support. not the replacement that is also valid for every application, not only the medical image processing. In everywhere, even we use the different AI applications these days, Gemini or ChatGPT or any or other applications. So we have to analyze the output of the algorithms or whether it's correct or not. And but of course, it's very fast to handle lot of data. That is one thing. So it reduce the I would say reduce the human workload for handling lot huge data or doing the calculations automatically what it can do. So these are the some references and thank you. So
Thank you so much, sir, for this
yes,
wonderful session. Also, students, if you have any queries or doubt, please
yes,
let sir know. He will definitely clear it out. Anyone, please.
yes. You can ask me any basic questions if you have. I mean, without the mathematical thing. So, if I can ask, the audience are mostly the PhD students or bachelors and masters or
So, I think there is a query in the chat box. I think someone
okay.
has, yeah.
The systems are now integrated with radiological systems and computers. Are you using any compiler? Um, yes, I mean these systems are. There is a thing I was just explaining that uh, previously without the deep learning area, there has been applications with the supervised machine learning. I mean, there are classical machine learning that has been done to detect the thing. To be on frank, I am not using the deep learning algorithm for medical image processing now. I mean, my research work was is related to the same thing as the image processing. I work in signal processing for communication thing because I'm a communication engineer or electronics engineer. So people used to, as I found that they are using now deep learning algorithms for the correct detection. So this is the thing that I found for handling this lot of data with correct detection.
Anyone else?
Okay.
Uh, is there anyone?
Okay. Yeah, there can be other different software to detect them. But if you go to the research on the medical image processing, this is the main thing that I saw in different literature also that they're trying to utilize the deep learning algorithm to get the correct detection from handling different data from the cancerous cells. So that is yes. Any other questions? Do you have any other questions?
I think, sir, no one has any other questions.
Okay.
Uh,
So the audience are mostly PhD students, or there are from people. I mean, candidates from different background or here. I'm just trying to know. I mean, so
Students, please respond.
no, I'm just trying to know that what will be the what has been the approach for the learning the AI to use the breast cancer or the health applications. That is something also I was thinking to trying to know. Okay, I can share. I think the email also you can get from the STN. They have the email. Um, so this is my email. So if you have any query or anything regarding the utilizing different algorithms for the medical image processing, of course you can send email. Also the signal, I think there will be a bit related to the image processing with the food and food science and technology and nutrition thing also, area also that I. So as a dietitian, I can use ML. I can say that they have to write the algorithms or have to start from basics that how can you use the machine learning. So one important thing is that even I talk to the computer science people that they get the data from the website, I mean different link, then they use different algorithms to process the data. So you get the data from there. It's different from my work that I have to generate the data from my experiment. It's much more different from here. That is the reason more people in computer science and uh, are there in even in research and in image processing also. In our electrical engineering background, mostly people work in the image processing because they can handle medical image data, other data also. You don't need to do any experiment or anything. Just you have to write the code of, and analyze the performance with mathematical equations. So then you need to write the algorithm then to process the data. So that is the way you can uh, uh, start doing the machine learning. Is my answer? Okay. Okay. Thank you.
Okay. Thank you so much, sir, once again. Students, if you have any queries or doubt, sir has already given his email ID. If you have any queries, you can ask, and also you will receive the recording of this entire session. Thank you, everyone. We can end
Thank you.
today's session here.
Thank you.
Thank you so much, sir. Students, you can leave now.